Hi, Vic Veer, ENT surgeon here. I want to tell you about why most people should have their nose operated on prior to having any surgery on their throat. When you're talking about people with obstructive sleep apnea, a lot of people with obstructive sleep apnea should be having CPAP, mandibular advancement device, and that's normally enough for most people. But there is a subsection of the population that do need surgery for their obstructive sleep apnea. Even though a lot of people say, well, I can breathe pretty well through my nose. And an awful lot of rhinologists, of nose surgeons, will say, his nose looks fine. He says he can breathe through his nose fine. You need a completely straight nose for CPAP because otherwise it puts pressure on one side. If your nose is like this, you're trying to put a nasal mask in, it just doesn't work very well. Even if it looked all right from the outside, it does need to be dead straight. So that's this is a constant battle I have with rhinologists to say it's not about how well they breathe in front of you in a scary situation in your clinic. It's how they breathe at night. Now, the other thing that's important is that uh, if their turbinates swell up so much that they can't breathe at all and they keep ripping it off, you do need an operation to try and straighten out the nose if that's needed and also shrink down the turbinates. But the idea is to stop it from swelling up, particularly if the sprays aren't working very well. So all people who are on CPAP should be using a nasal spray because typically this happens after, sometimes even after a few months, sometimes after a few years. Your nose gets quite blocked up with CPAP. And it also allows you to move from a full face mask to a nasal mask or some other different type of mask. It opens up your ability to use the CPAP device. And some of you are thinking, hang on, I want surgery to get me off the CPAP, not on it again. But some people out there just can't use CPAP at all. And then I say to them, well, look, I've done a drug induced sleep endoscopy. I know why you have this problem, and you need these three, four operations. Uh, but they're all a bit scary and painful, and there's loads of risks because that's the problem with surgery. There's loads of risks associated with it compared to CPAP and the other things because there's no risk there. But then I say to them, look, if I could get you to use CPAP to make you physiologically uh, healthier, better, and more able to have these operations, then your risk of the surgery will come down to a normal level. So, normal people who don't have obstructive sleep apnea have no real issues of having tonsils taken out or something like that, or stitches put in the back of their throat. But if you've got obstructive sleep apnea and you're not having treatment, with CPAP or something like that, then how is there anything going to heal? All these stitches that are in the back of your throat, if no oxygen is getting there, how on earth is it going to heal very well? And therefore, people with obstructive sleep apnea, not just throat operations, but hernias and knee operations and things like that, they all have a higher rate of risks and complications. And also, there's a reduced surgical success rate. So, to improve your surgical success rate, I need to get people onto CPAP first to fix their nose or deal with some other problem. And then when they can use CPAP, I say, right now we need to get you off it again, and then do some operations on the throat, which is why a lot of people need their nose operated on first before moving on to the throat operations. But there are other reasons to start off with the nose, because if you have a blocked nose, and I think to myself, well, look, these operations on the throat are pretty horrible. Maybe instead of going straight for a big operation on your throat, maybe we can open up your nose. That way, we can give you a device for your mouth. So, for example, a very common one is a mandibular advancement device. This is a device that goes into your mouth and sort of brings your jaw forward because some people have a problem with their tongue. Their tongue falls back and blocks their breathing. You can't get air past the back of their tongue. Teeth are there, sorry. And so, to use a mandibular advancement device, brings your teeth and jaw forward, and it also pulls your tongue forward as well. Great evidence for its use. Trouble is, if you've got a blocked nose and then you put something big in your mouth, how on earth are you going to be able to breathe? If you've got no opening here or opening there, people just end up and spitting it out in the middle of the night. But if you can unblock someone's nose and then say to them, look, I've unblocked your nose. It's a relatively simple operation. It takes about 20 minutes to 40 minutes or so. And now you should be able to breathe through your nose after a few weeks of recovery. Yes, I can do your operation on your throat, but actually, most of your problems on your throat are your tongue because I've done a drug-induced sleep endoscopy. Maybe you should try a mandibular advancement device now rather I mean, you may have tried it before, but you wouldn't have worked, it wouldn't work very well for you. Try it now and see if you suddenly feel loads better. And if you feel fine, then why have this huge operation on your tongue? Why not just use a mandibular advancement device? And some people go, well, yeah, I don't want an operation on my tongue. That sounds ridiculous. I'll try the mandibular advanced device. If it doesn't work, I can always come back. And that's why unblocking the nose first, even though it looks relatively normal in some situations, unblocking the nose, because I've seen what they're like when they're lying down asleep in front of me, unblocking the nose seems to help people use opens up all the other devices that you can use in your mouth, like an iNAP device or a tongue retaining device, a mandibular advanced device. All these things are out there that can help people with a tongue-based obstruction without needing some sort of surgery. I'm going on to the next thing, that why unblocking nose is really important, because if you have a tongue-based problem, and it's typically tongue-based problems, these things, but you can happen with other things as well. If you have a blocked nose and a tongue-based obstruction, they go hand to hand because, let me explain it. If your nose is blocked, you naturally have to open your mouth like this at night, which is fine. You breathe through your mouth gets a bit dry, and it's not very good because you feel like you've got a cold all the time. You feel unwell and tired and whatever. But no one sleeps like this at night. They sleep like this in that sort of unattractive middle-aged man sort of way. So because your jaw just sort of slacks back. And when your jaw slacks back, your tongue falls back as well. And if your jaw is slacking back, then your tongue is falling back. So your tongue falls right back and blocks your breathing. Now, on the other hand, if I unblocked your nose at night so you can breathe freely through your nose at night, you may go from a person like this to a person who closes their mouth at night. And that brings your jaw forward ever so slightly and makes you close your mouth, puts your tongue in the right position. It may help you with your breathing, just enough so that I go to you, well, actually, yes, you do have a problem with your tongue, but now I don't have to operate on it so aggressively now because you're now able to sleep with your mouth closed at night because now you can breathe through your nose. Now, some people don't automatically revert back to nasal breathing after a nose operation, and people still sleep like this. And therefore, sometimes I tell people, look, after this operation, if you're still not breathing with your mouth closed and also your sleep apnea isn't that bad, then it may be worth wearing a chin strap, which is this Knightsbridge dual strap chin strap that keeps your mouth closed. I wouldn't use the ones that go down to the back of your neck like this because it pulls your jaw forward like this. But the ones that go right at the front, like a little rubber band at the front like this and keeps your mouth closed, you can still breathe through your mouth, so it's still safe with people with obstructive sleep apnea. That's why I'm not keen on people with mouth taping with obstructive sleep apnea because you're just causing hypoxia. And I've got a video on mouth taping if you want to look at that. So the idea is that for about a few weeks after your nose operation, as long as it's all healed up and you're struggling to learn how to breathe through your nose again, you can use a chin strap at night for about sort of 4 to 6 weeks. And then you sort of trained to close your mouth at night and breathe through your nose at night. And it works a lot better. And then you can take the thing off. And it's safe because you can still breathe through your mouth if you really needed to. Point of that section was that if you unblock your nose first, and I know I need to do a tongue operation, I don't need to be so aggressive on that person's tongue anymore because before their tongue was all the way back here, I've made a few millimeters by them just closing their mouth. And that's given me a little bit of room. And now I don't have to cut those few millimeters out of the back of the tongue anymore, which saves them pain, saves on the risk of taste disturbance or tongue weakness, although that's quite rare. But these are all risks. And if you're trying to reduce your risks of these operations and leave you with a long-term success rate, then why not do everything properly? Which is why another reason why you should get your nose fixed first before doing the throat operations. This is the standard thing when it comes to sleep surgery. Now, I should say at this point that nasal surgery very, very rarely does anything for obstructive sleep apnea. It makes people feel better because they're now unblocked. It doesn't really fix obstructive sleep apnea. There is a little bit of the tongue moving forward when you're closing your mouth. So it does change it ever so slightly. And there are some airflow changes as well, which are all good for you, but it doesn't really fix obstructive sleep apnea because remember, the nose cannot cause obstructive sleep apnea. Fixing it is a good idea and it's important to do so. But if you think that the nose causes obstructive sleep apnea, unfortunately, that's not true. Because if you think about it, everyone with a cold or a flu who gets a blocked nose, they don't suddenly revert to having obstructive sleep apnea that night. They just breathe through their mouth. And so you need something with obstructive sleep apnea that blocks your nose as well as your mouth. So you're blocking all exits and entry points. Because if only one is blocked, then the other one sort of takes over. It's like a backup system. You need to stop both backup systems. And it's interesting how people look at it as two different things, but you can look at it as a backup system. We have a lot of redundancy in our bodies for problems like this. Breathing is really important. And if there's a possibility that you could block off your breathing or having an issue with your breathing, then there needs to be a backup. That's just evolution. We wouldn't survive this long without some sort of backup to breathing. Anyway, the other thing I need to say is that occasionally, if you've just started snoring, and we're not talking about sleep apnea now, more like snoring. If you're only snoring, there are some situations where you go, "Oh, hang on, I think I've got a blocked nose, and that may be the reason why I've just started snoring." And that can happen. And so unblocking the nose in those very early stage people can help with snoring in those situations. It's typically you've moved to a new city, like if people who come to London think, "Oh, wow, the bright lights and everything." And then they realize there's London plane trees all over the place. Nearly everyone seems to be allergic to London plane, and no one ever gets tested for it. Where everyone gets tested for beech and birch or whatever, these grass and all these other things. No one bothers testing for London plane, but everyone is allergic to it. These poor Americans that come across and they go, "Oh, well, I was fine in wherever." Um, but yeah, you soon get to enjoy the London air. We've got a bit better in terms of pollution. I'm not trying to put people off, but a lot of people suddenly at the age of 60 suddenly can have a blocked nose, and then they start snoring and think, "Oh, no, I've got sleep apnea or anything." It's sometimes just a blocked nose, so fixing that nose, possibly with sprays, and that's normally all you need, is enough to fix that. And if you want to know how to use sprays properly, I've got a video here about that. But hopefully video this video, should I say, explains why you should have your nose corrected first before moving on to the proper operations in your throat, which really delve down into the actual reason why you have obstructive sleep apnea and snoring. Anyway, hope that makes sense and clears up some confusion about this. Do take care. Bye bye.